Hi, everybody. I'm a little late. This is Dr. Lisa. I am coming to you from the Natural Health Improvement Center of Columbia, Maryland. And tonight we're going to be talking about acid reflux. It's one of the most important things that we can deal with. And um, acid reflux is something that has lots and lots of sufferers. So let me tell you just a little bit about me. I am a natural health provider. I'm a chiropractor in practice for 33 years. And as a chiropractor, I have structural uh, solutions to acid reflux. I also do a technique called nutrition response testing, through which I can find out what nutrients a person is missing, not theoretically, but actually for each individual person. So some people need some things and other people need other things, and there's nothing cookbook about these wonderful human bodies that we have, but rather they are quite individual. There are similarities, and so we know what to look for, but everybody's different, and my practice is very individualized. So I'm here in Columbia, Maryland, and tonight we're going to be talking about acid reflux, as I said. So acid reflux is a symptom of a digestive problem in which the stomach is not digesting its food. So we eat food, the food goes down our esophagus, into our mouth, down in our esophagus and into our stomach, where it is supposed to be broken down into tiny little pieces that can then go into our small intestine and then everywhere they're supposed to go. So our body is supposed to absorb nutrients and we are supposed to be able to use them. So a lot of people have this feeling of heartburn, and it's called heartburn because the feeling of burning is close to the heart. And so there are many, many people who go to the hospital and, worried that they're having a heart attack because they have this horrible pain in their chest area oftentimes. And sometimes people have symptoms that they don't know are acid reflux. A persistent cough can be as a result of the stomach contents coming up into the esophagus. And instead of it feeling like acid and burning in the chest, it can just cause a cough. And so that can be misdiagnosed as well as something else. It can be diagnosed as allergies. It can be diagnosed as cold. It can be diagnosed as something misunderstood. So what we need to do is find out if the person has enough acid in their stomach to break down the food that they've just eaten. So the solutions have to do with, first of all, finding out what the problem is, and I do that in my office all the time. I can find out whether it's a structural problem. In other words, is the valve that's at the bottom of the esophagus and at the top of the stomach opening and closing as it should, or is it loose and floppy, and is it allowing that acid to go back up into the esophagus rather than staying in the stomach where it's supposed to be digesting food? So if it's a structural issue, which is often called and often is a hiatal hernia, that doesn't need surgery in many, many, or even most cases, but rather we can handle that with a chiropractic technique that some chiropractors know, that I know. And so many of my patients are just incredibly grateful that we can do something structurally to help with this horrible pain that they're having after they eat. The other thing that can happen is that the person doesn't have enough acid in their stomach. So if a person goes to a medical doctor and they get an antacid, or if they even go to the drugstore and they get some Tums or something like that, well, what that's going to do is going to decrease the acid. And yes, those things can definitely be helpful if they're used only as symptom relief and very temporarily, because as I've already told you, you need to have enough acid in your stomach to digest your food. And if you decrease that acid in your stomach, your food won't be digested. So you don't end up being able to use the nutrients because your food doesn't get broken down. So that starts a cycle of acid reflux that really, unless it's handled properly, can cause somebody to end up taking acid reducers for a long time, which is actually very dangerous to people's health. I've had patients who blame very serious health issues on the fact that they never got taken off of these acid reducers, that are only meant to be used for a couple of weeks, and they've been on them for years. So all sorts of things can occur as a result of that. If you don't get your nutrients, then you can end up with many health issues, everything from heart issues to skin issues to mood concerns to all sorts of things, even foggy brain and hormonal issues, because you're not getting your nutrients. So that's a whole conversation that I have with my individual patients as they come up. So depending upon what happens in my office with the patient, if I find certain manifestations of decreased nourishment, then we have conversations about that, about what a person should be able to eat, about supplying enough of the digestive enzymes to the person, about getting the acids that they actually need, that are healthy acids in their stomach so that they can digest. Starting with chewing your food. What can you do at home to help yourself? Well, the first thing you can do is to chew your food well. I remember when I was in chiropractic school, we had literally 10 minutes to eat, and it was not possible to eat in that amount of time and chew our food. Well, now what I realize is that chewing food is the first step to digestion. Choosing good food is the first step to digestion, of course. And then after that, chewing 30 times for each bite. It's not easy. You really have to slow down in order to get good chewing in. And don't drink too much liquid with your meal, because you don't want to dilute that acid that's in your stomach that's meant to digest your food, break down your food and digest it so that you can use it in your body. But rather, if you drink a lot of water, for instance, with your meal, you're going to dilute that acid, and your food won't break down the way it's supposed to. And if it doesn't get digested, it doesn't get absorbed. And we really do see some pretty severe cases, in some cases, of malnourishment, what I consider malnourishment, when people are not digesting their food. And the reason they're not digesting their food is because they have a problem that is pretty easily solved once it's figured out. And I figure this stuff out in my office every day, and I'm not dealing only with the symptoms. Sure, I care if you're having acid reflux. I care if you're uncomfortable. And even more importantly, I care that you're healthy. So once we figure out which supplements to give you, your digestion will improve. And I have so many patients I've helped with this. It's not really that hard to help. And once somebody listens to this logic, they'll begin to understand that it's very important to have a healthcare practitioner who is not only going to be dealing with the symptoms, but rather with their full health. And that's what we do here at the Natural Health Improvement Center of Columbia, Maryland. So I want you to chew your food well. Don't drink too much water or anything with your meal, so that you have just the food, chew it well, get it down into your stomach where it can be broken down, and then do drink your water in between your meals. That's a better idea. You can sip something with your meal, but don't drink a lot. Don't have that be the time when you're drinking all of your water, for instance, because you do want to get about half your amount, half your weight in ounces of water per day, but do it in between meals. The other thing is some people find that using a little bit of apple cider vinegar, either on their salad or in their cooking, or with some water in the beginning of the day, can actually help their digestion. It seems a little bit counterintuitive since we have been trained to think that this acid reflux, we think of it as acid reflux. So we think that the acid is the bad thing. It's actually the reflux that's the problem. So if we can handle both the structural and the chemical or the digestive part of the problem, then the acid becomes our friend again, the way it's supposed to be. It's supposed to be our friend that helps us digest. It's not supposed to come back up into our esophagus. When it does, it's very, very painful. So if our food doesn't get digested, it sits in our stomach. It doesn't go through to the small intestine because there's a valve at the bottom of the stomach that only opens when the contents of the stomach are at a certain level of acidity. So if we're taking antacid medications, then our our stomach doesn't reach that level, so it's harder for the food to even get out of the stomach. So it sits in the stomach, and the acid that's produced is from the fermentation or the rotting of the food in the stomach, and then that comes back up again. So it's a little more complex just than the symptom of being acid reflux. And I would love to be able to help as many people as possible with this because I want people to be well nourished. I want people's light to shine. I want everybody to be healthy and happy, and that's what I do at the Natural Health Improvement Center of Columbia, Maryland. So if this has interested you, or if you have anyone that you know who struggles with acid reflux, please give me a call. The phone number is 667 240 2923, and I would be very happy to have a free phone consultation with you or anybody that you refer, and I'd love to talk with you. So this is Dr. Lisa Gordon signing off. Again, the phone number is 667 240 2923, and I will see you again here next Tuesday at 5:45. Bye-bye.